Thanks very much, and thanks for inviting me to present today. So, I am program manager at the Health Research Board, and I was tasked together with the team to integrate ORCID in our processes. So, I'm going to let me see if it moves. Yeah. So these are the topics of my presentation. Is very much the integration into the funding workflow. It's the integration, so the grant electronic management system, and also very much about crediting grant holder for their funding, and also how we use the affiliation manager tool to recognize reviewers for their service to the peer review and panel review process in the HRB. And also we have a small award that we give for impact, and also we're using the affiliation manager as well to recognize these distinctions for grant holders. So the HRB is the main funding agency for health research in Ireland. And in addition to be a research funding, so very much providing funding for health research that has aim to improve patient care and health outcome. So we support university and hospital. We also have an evidence center, so which provide evidence to policymakers. We work very closely with the Department of Health in Ireland. And then we also a regulatory research ethics and consent declaration committee. So it's very much for how research is funded at the highest ethical governance and quality issues. And also we have a national information system, basically collecting information, national information about, for example, alcohol use, disability, and psychiatric care in Ireland. So we're a mix of different functions, but in particular, I work in the research funding division. So in 2019, we start discussing at national level with other group in Ireland, funders, higher education authority, higher education institution, how ORCID as one of the PIDs of the can be implemented, adopted in Ireland, and specifically for the HRB. From 2019, when initial discussion came, we went and formed this Irish Consortium, and we've been working together under the coordination of a group to implement ORCID. The idea was that for the HRB to improve the efficiency of the grant and reporting management process, enhancing the visibility and impact of funded research by the HRB, and provide proper attribution to HRB funded research and reviewers. So it's very much reinforcing our commitment to accelerate knowledge discovery, increasing integrity, transparency, and reproducibility of research, improve the research assessment, and strengthen research integrity practice. So from 2019, then in 2021, we proactively start the integration. It took almost 3 years, but also there were some challenges. But at the beginning, there was not really a commitment from the vendor of our, so the system we are using for our grant electronic management system. So things were delayed, not necessarily for technical issues, but because there was no vision or commitment at the beginning to integrate ORCID. So what we were doing at the beginning was really to strongly encouraging researchers to use ORCID in grant application. It was not mandatory, and that's linked to GDPR regulation in Ireland and in Europe. But we were asking people to add ORCID in our grants application, but we're not really, because there was no integration, there was not such a link. So it was just a number that if you want to go and check, like for review purposes, people had to copy and paste in a web link. This was really to start awareness building. When we started so what we have now, a few years later, it's an integration of ORCID at different level and with different systems. So we have a grant electronic management system called GEMS, and so that's integrated really at application stage and also a grant awarding stage. Then we use affiliation manager tool to basically recognize reviewers for their support to the HRB, review process. So that's not part of the integration, but it's still another tool that really, without necessarily many technical difficulties or challenges, can really provide a mean to recognize reviewers, which is very important in from a funder perspective. The HRB has also another platform with F1000, and this is the HRB Open Researchers for Open Publishing, and they are fully integrated with ORCID. So reviewers and authors of the publication, once they get the publication published, the article published, are recognized through ORCID, and the same are the reviewers. And then we use a Research Fish, which is another platform for a grant to monitor the progress of a grant. So it's very much looking at outputs, outcome outputs, and impact, and that's also fully integrated with ORCID. So it's not necessarily HRB system, but in the ecosystem, let's say, of a grant from application to impact, that's how ORCID can be used. So at application stage, ORCID, so applicant can register, they can link the ORCID ID to the GEM system. This is not mandatory, but is highly encouraged, especially because now we have the full integration in which then we credit these people if they're awarded by the HRB in their ORCID. So linking ORCID ID to HRB accounts enables seamless integration to publication data into funding applications. So at the moment, so with our system, the data that people, so if you are an applicant and you apply for funding and you want your record of publication, you can choose ORCID or PubMed. For funding is not integrated, and there was so much work to be done. We decided we were not going to integrate, and that's part of the challenge sometimes with this integration of system. So this integration reduces manual data entry and ensure accurate attribution of previous scholarly work. In terms of the review stage, linking ORCID ID, reviewers cannot link their ORCID ID to the GEMS profile, and then we use the affiliation management tool, and I'm going to describe that in more details later in the presentation. The public recognition of this contribution is still anonymous, so it doesn't compromise the anonymity of the peer review process, and they still aim to enhance scholarly visibility. At the grant start, what has happened that HRB through the GEM system push data from GEMS to the ORCID record of an individual, and that can be the lead applicant or co-applicant. So if they have their ORCID ID linked in the application, once the award, the grant start, the system recognizes this and pushed automatically data. And this process creates a verified and authoritative link between research and HRB funded project, and is very much to enhance discoverability and improve future reporting also of the HRB funded research. So then I mentioned the open publishing platform. So authors to this platform, they want an article or it could be a methods published. They use the ORCID ID as well as ensuring persistent attribution and linking research output. The platform supports transparent peer review, so the peer review is open, so fostering openness and trust in research quality, and both peer reviewers, as I mentioned before, and lead and author of the paper are basically credited for their work. And finally, in terms of our outcome reporting and impact, ORCID is linked with Research Fish. This is outside the HRB, let's say, sphere, but it's still in line with what HRB is trying to do. So HRB has been using Research Fish since January 2024. Unfortunately, the platform is going to cease to exist since next year, so we have to find an alternative platform. It's another example of integration between different platforms. So collecting ORCID ID during the application. As I say, this is not mandatory to apply for applying for funding. Other funders have moved to mandating this. But when the research apply for funding there is a prompt to authenticate their ORCID ID and using the ORCID member IP to request permission to read and write to the ORCID record. So there is a consent that is requested. So the applicant can retrieve data, only publication from the ORCID profile, and unfortunately it was not possible to integrate in a way that other data like funding could be retrieved. Upon awarding a grant and the grant becoming active, so sometimes when you write you have a contract between the lead researcher, the host institution, and the HRB, the grant is not necessarily active, so we would push data to ORCID just when there is a start date and the grant is active. So GEMS, our grant management system, push funding information, so it's the grant title, the funder's name, and award date to the research profile. And I'm going to give you an example. HRB research publication, as I mentioned, open research and tracking. So this is kind of a duplication, but is there for you to read maybe later. So I'm going to describe a little bit the integration and some reflection that we encounter some reflections. So the vendor interest and the roadmap on ORCID was limited when we started this process in early 2022. So the discussion about functionality development with the vendor were slow. We were meeting them. We were giving the must do or the nice to have, but things were not really moving. So it was very frustrating for the first period. Most of the development, the testing took place in late 2022 and throughout 2023. There was different questions for GDPR, so we had to several times go to our DPO, and the consent user delay also the process. In mid-2023, the version in GEMS did not have an API 3. So the new ORCID functionality was not available to us. And then there was another problem where we didn't have actually in our GEM test system, we were not connected to the ORCID sandbox, which means we could not test the new functionality. So then was available in July 2023. These were all delays. So a project maybe they could have been start to finish in 1 year, took probably 2.5 years. And that's an example of my colleague when he was testing the transfer of data through to his own ORCID, and that what was appearing through his ORCID when funding were pushed. And that it was another example of ORCID testing where there is a lead and co-lead. Co-lead for us, ORCID has different contributors terminology. There may be other funders. That's something in the future we're probably trying to probably coordinate a language and a terminology. But co-lead for ORCID is what we would define as a co-applicant, or actually could be a co-lead, a co-investigator. So we made so some people would acknowledge just the lead applicant, and we decided that because science is a team effort, it was important as well to provide this contribution as well to acknowledge the contribution, also the co-leads and co-applicants. So since 2024, the HRB made the decision to not. So when there was a full integration of the system, we had to decide, are we going to go with anything awarded from now onwards, or we go also backwards? So we decided to not transfer data on previous grants, because then you start to have the challenges to say what is active, what is closed, what is going to be closing soon. So we decided to transfer data starting 2024 for any data awarded from that point onwards. And as I say, it was the lead applicant, which for us is the principal investigator, and co-leads are the co-leads. What's in some funding agent will be called co-PI. or co-investigator and also co-applicant. And in some funding scheme like fellowship would have mentors. They would be also acknowledged, although they are acknowledged as co-leads. So as March 2026, the HRB has 98 grants pushed to ORCID, and with additional three waiting basically to start their grant. And we have 3,843 portal user with ORCID number. There was a news story. I mean, this is not a news story anymore, but we published something in 2024 in our website really to acknowledge the work we have done and that ORCID was fully integrated with our system. So now I'm going to move with the affiliation manager, which is a tool in our case to recognize HRB reviewers. So what was the problems? The peer review is a cornerstone of making funding decision as the effort play a crucial role in maintaining quality and integrity of the process. Despite their significant contribution, peer reviewer work remain invisible without clear recognition and appreciation. So in our commitment to foster a more supportive and collaborative environment, the value the contribution of reviewer enhance the overall assessment process, we for many years have been sending letters to all reviewer after the funding allocation process, after our board approved the funding recommendation from a panel, and that was just a talk and to say thank you. But also since 2024, the HRB has been crediting reviewers for their service via ORCID. Now, the GEMS ORCID integration would have required an extensive further development on GEMS, and given our experience to develop the integration of ORCID or other development in our system, we decided that was not worth doing because it might have taken 3 years to do it. Because, for example, peer reviewers are integrated in our GEM system in a different in a different way than panel reviewers. So it would have been really challenging to do. But because we are part of the the Irish Consortium with ORCID, we basically were aware of this additional platform, the affiliation manager. We could be with our purposes could be used to credit reviewers for their service without any technical challenges. So, for example, institution can use to transfer data about employment or educational, for example, PhD or master and so on. And others, then other institution can use for membership and so on. So, how does it work? A researcher can add an affiliation to the ORCID record by granting an organization. So the researcher are asked, so the reviewer are asked by us, by consenting to basically to transfer these data to their ORCID. But is ultimately up to the individual researcher or reviewer in this case to create and maintain their ORCID profile. So ORCID only requires someone to give permission, in this case to the HRB, to read and amend ORCID record every 20 years. So if somebody has already given permission, we're not going to ask again. Is not done by the system, but the user can delete that consent anytime they want. So this is a bit complex, but there are two ways the system can transfer data through the affiliation manager tool. And one is a member admin. So there is the first one is let me remember now. So basically there is one system where we send individualized data to each reviewers, and then is a bit more complex because you need to have individualized personalized link for each reviewer. And then we have another system through the member portal, where the member portal does the majority of the work, is less personalized, but from our point of view, we thought was more effective. So we have an Excel spreadsheet, is It's similar to an Excel spreadsheet, and it's a CSV file where in our case, this is a template that ORCID produce, but in our case, we are going to use the service, and then you can use, for example, this part here, the row 11, which is for reviewer. And then you add for each reviewer data in this file. Actually, I have it here. And then when we have basically a list of reviewer, we do every 3 months, and we have, for example, a list of peer reviewers and panel reviewers. And then when we transfer data to their ORCID following consent, this is an example of my ORCID ID where I serve as a panel member in an internal panel in the HRB, which was the conference and event sponsorship scheme, and this appears. Now, as a panel member, because we publish the list of panel members following the funding recommendation, we can add the name of the funding scheme, but for peer reviewers, which are done anonymously, we don't do that. So this, because it's public knowledge, it's on our website, we can do that. Otherwise, we wouldn't do that. So the benefit of Route 1, which was the more personalized link that is sent to the reviewers, it's this, but the drawbacks that we thought it was it's more labor intensive and time consuming to generate these personalized letters and email with the correct link, which add also a potential human error. So we decided to go with Route 2, which is more the more centralized one, which is less labor intensive for the HRB coordinating. There is one person in HRB who is coordinating, and there is no risk in the wrong link to be sent to reviewers. The drawbacks, of course, there is a generic email that we can send to each reviewer, and there is a need to coordinate the sending of the thank you letter by one person as well. So we went with this member portal option, and then also we had to make the decision: do we want to do fully centralized or we want to do decentralized? And that was very much in terms of the coordination. These are all things, to be honest, that we didn't think at the beginning when we decided, oh yeah, we're going to do that. We're going to use the platform, and this seems a great idea. And then when you start thinking about, and that's something, if somebody's interested, I can send our SOP, because we had to make this decision and we had to provide a case to our board of why we're doing this and how we're going to do this. So we decided to go with a fully centralized system. So there is one person who was supposed to be here today presenting with me, but she couldn't, who is the coordinator of this system. So implementation plan was to decide all these components, was to decide Route 2, centralize, and also to send this information to ORCID in batches. For example, every quarter following keyboard meetings that we have, for example, in March, in July, and October and December. And then the thank you letter that we used to send had to be tailored in a way that we can reference ORCID and the fact that people are going to have to send, they have consented before for the ORCID, but they are going to still have, for the first time, if they accept the invitation from ORCID to transfer this data, they have to say yes. So this is an example of a thank you letter that HRB sent at the end of each funding recommendation for each scheme. And because sometimes there is a lag of time between when the funding recommendation is done, it could be done a few months before, and when we send this letter, that we actually have to reference again that they are going to receive an email from ORCID. So before we made this decision, the executive team in the HRB asked us to see, well, we're going to put lots of effort in this. It seems a great idea, but are actually the panel members and the peer reviewer going to use it? Are they interested in something like that? So we contacted 396 reviewers from the previous year. They have been serving to the HRB peer reviews process, and we received 92 responses, which equal to 23% response rate. And there is a summary of the results. So the majority say yes, they have an ORCID profile, which is a great start. And did you serve as a peer panel review? Doesn't matter. For us was to see if how many were peer and panel. Of course, there is more peer. Would you be interested in being recognized by the HRB for your role as HRB reviewer under professional activity? And they say yes. So there was a 94%. And then when we ask, would you be interested in being recognized as HRB reviewer? Some people say, I don't feel strongly one way or the other. I assume this is a quite established investigator, but I don't see a reason to why not. Other people say demonstrate professional standing in the field of study and also commitment to contributing meaningfully to a scientific endeavor. So generally the responses were quite positive. This is just a snapshot. So the implementation has all this linked this task. So we have to have an internal approval and a commitment to the process because like I was leading this process, but if I leave the HRB, there is a commitment from the organization. This will be continued and somebody else will take the lead. There was engagement with the data protection officer from the HRB perspective, which is still engaged. We're still engaging because we're trying to get rid of some of the consent we are asking to decrease the bureaucracy if it's not necessary. Appointment of the affiliation manager coordinator, the SOP preparation and internal communication and external communication, consent form for peer reviewer had to be included in the peer review form, thank you letter had to be reviewed and revised. Then there is a planning each year, the timing for the HIB data transfer following each board approval, template had to be prepared and then internal training. So I don't have the most up-to-date information from this because Marta was on leave. But in the 12 months activity from April 2024 to April 2025, 208 reviewers were asked permission by the HRB, 49% had data transfer, 45% consented, but have not accepted data transfer. And this is possible because some of them did not have ORCID at the time, but also because there is an extra step to consenting. And I think there is a bit of, there might be confusion that people are consenting once to the HRB, they think this is done, they don't have to do anything else. And that's the reason we're trying to review our process. 7% did not provide consent to HRB, and I assume these are all quite established investigators where credit on ORCID doesn't change their profile. So this is, I think, my concluding slides. So the challenge was to increase efficiency by integrating our grant system with reviewers' acknowledgement. The solution was ORCID Affiliation Manager tool as an easy tool. It's still complex, but it's not technically complex. To be aware of GDPR and personal and use of personal data, which is something we're still trying to confirm, to note this public knowledge of the ORCID to reviewer does not compromise the anonymity and confidentiality of the assessment process. So we're very careful if somebody is peer reviewer or public reviewer. The implementation started in April 2024. And as I mentioned, this is the 12 months activity. At this point, it's a 24 months almost activity. This is my email address if somebody want to ask any question at any stage, and I'm very happy to take any question. I'm gonna stop sharing.
Well, thank you, Annalisa, for such a great in-depth presentation for us. The Q&A is open, so I invite everyone to please submit the questions that you have. We did get a couple of questions at registration, so I'll start there while folks gather their thoughts. So our first question is, for those new to the ecosystem, how does HRB define the transition from ORCID as a simple ID to a data integrity engine?
Yeah, so we started with ORCID as a first persistent identifier. So like I say, a simple ID, but even, when I started this, I was probably looking at just a simple ID as in the question, but actually when I start to work a little bit more on ORCID, and now we're starting to integrate. We're trying to get into a roadmap to integrate with other system. It's really become a data integrity engine. So it's like engine. So it's like really to not look in a narrow mind as one identifier because there are many, usually we were quite used to the DOI for publication, and now we're really talking about grant ID, organization ID, and so on. So it's really, we have to look at this as an ecosystem of persistent identifier.
Great, thank you. And then can you tell us a little bit about your journey to joining the ORCID Consortium? And as a funder, what was the primary light bulb moment that convinced HRB that an ORCID Consortium membership was a necessity for your organization?
Yeah, so as I mentioned in the presentation, so we start discussing this in 2019, and that was a group brought together a national level from the Higher Education Authority, really moving to the adoption of ORCID as one of the persistent identifier. And so from there it was basically took probably 2 years to basically decide, okay, we are going to do this, we are committed to this. And it made sense in Ireland. Ireland is quite small, is a very small country. So it was no brainer that the national coordination was probably the best way forward. We get a premium membership with a lower cost. We have a body, so we have a team that is coordinating, leading the consortium, which provide a centralized support for the different members, outreach, and training support. And also, basically, we were benefiting from not probably a close collaboration, but definitely from the experience of other funders or other institutions and their challenges. And it's probably, yeah, it's a sharing of the information of the challenges or the success stories. And being involved in this national effort is probably was bringing also the research community together. So because if everybody was doing a different level from the funders or the performing organization, there was this building of awareness, but also of the adoption of ORCID at national level instead of just being one funder doing that.
For sure, for sure. And then our next question talks about reducing workload and burden, particularly for applicants. So, when using ORCID for funding applications, does this reduce the workload either for the applicant and or the funding administrator? And have you tried to quantify how much the workload is reduced?
Yes, so I can't, yes, in terms of quantify, I'm not entirely sure, but definitely if researcher or users in general, trying to keep this their ORCID record up to date. When they apply to grant application now, many system and many funders use ORCID or PubMed, how source to actually transfer your funding date track record or the publication track record. So that's already a winner for the researcher. In terms of the funder is probably more funders, we would use ORCID to say ORCID is in the application, so the review process, reviewers can use the link to corroborate some other source of information for the researcher perspective. And then from the funder is probably more in the post-award activity when we start to link as well into the output and outcome, even with other system. But basically the ORCID ID is such unique that you link their grant activity with publications that are coming from that grant activity to the impact in society or in the field. So I can't really quantify because I've never done it, but I think there are studies there that have done it. And that's, I think, is the roadmap as well. The many countries are trying to implement a roadmap for other type of persistent identifier. And then, although at the beginning there is a cost, there is a technical challenge. I think once we get to a system where everything is linked, we are going to really see the payoff. Yeah.
For sure. And I think this next question kind of addresses more from the researcher's perspective. You were saying that the authentication of ORCID at the point of funding application is not mandatory. Is there an incentive in providing the ORCID information from a researcher's point of view? And do you envision this to become mandatory at some point in time?
Some funding agencies, even in Ireland, are mandating. I think the advice to us, I think was through the consortium, was because of the GPR rules it was better to not doing. But we can see that our users are increasing because we keep asking. The main incentive is that we now also state in our application form that if these people are funded and they have an ORCID ID, we transfer data in their ORCID of the grant funded activity. So that's the main incentive for them. First of all, because they might have, they have the publication record in PubMed. That is probably not the main concern from them. But I think if somebody has an ORCID ID and they want their grant written in their ORCID ID, that's the main incentive for them. Yeah.
For sure. And then in relation to that, how has HRB managed permission fatigue where have you found that researchers find it cumbersome to grant access throughout multiple touch points?
Not really. I don't think so. Currently, as I say, people can choose their own system to transfer data. So they have a choice and it's not mandatory. So, but we are seeing definitely there is an uptake. I think it's more, and sometimes before I was seeing sometimes people would have an ORCID ID because we are asking, but actually if you go in the ORCID ID, there was nothing. So I think people are now more interested in keeping that up to date. But the idea as well, if the system like the HRB or the publisher transfer data is not up to them to add information. Like I spend time in putting information in my ORCID, even if I'm not a researcher anymore, just because I'm the ORCID coordinator in the HRB. But I have to put all my previous experience, my PhD, or all the experience I had in employment. But if actually this was done by my different employers, it would have facilitated my work. So that's the idea of having the system integrated and avoid as well inconsistency of data or a human error in inputting data. I don't know if I addressed the question about the fatigue.
I think you did. So thank you for that. Our next question is wondering if you could give some more details on the open access publishing platform that HRB uses.
Yes, so it's we use the F1000 platform, and it's very much a platform where HRB funded researcher or collaborator of HRB funded researcher can publish for free. So we pay the APC and we pay an annual fee to the platform, and they can basically publish their article. They can publish some preliminary data, or there are some, I can't remember, there are kind of research methods as well, which is quite well used. In terms of, is it about ORCID, or I don't know if the question is about ORCID or more the platform, but it's very much free to use from the user perspective, and then is indexed in PubMed. Now, there is no impact factor. The idea is to move away from impact factor and those type of metric. So some people use for other reasons that is not maybe the research article they want to publish in other type of journal, but it's still quite a good platform where it's open access, so it's open to everybody, and there's also an open review. So the reviewers that are selected by the platform write the review, and is publicly available, and the author of the article of the research output can address the reviewer's comment online openly as well. In terms of ORCID, the system is fully integrated with ORCID. So what happens is the author have, I think in that case is mandatory, they have to have an ORCID ID, and also the reviewers. So once the publication, the research output is published, is automatically sent in their ORCID profile, all the authors, and the same happen to the reviewers. So it's fully integrated. So let's say they don't use the affiliation manager to send data to the reviewers like we do.
Gotcha. Well, thank you for all that, for all the detail on that. We still do have plenty of time for questions. The Q&A is open, so submit them as they come to you. I'm wondering, could you give us a look behind the scenes, the work that you and your team do on ORCID? What do you like? What does the minimum viable team look like for HRB in terms of staff roles and weekly hours dedicated to ORCID?
Yes, so we were a small team. So when we started, it was me. So basically, it was me as a program manager, then there was a project officer and the GEMS administrator, so the person that administrate the grant management system. So they were the two people that with more technical expertise, and they were the one really speaking more technically with the vendor. Our Symplectic was the name of our vendor for the system, and then I was there more as steering, guiding, decision making, well, together based on their expertise and technical consideration and so on. So we did this, and I don't think if we had a bigger team, it would have been quicker because we were always ready to test once the system was ready to be tested. So we never really delayed from our part. The delay was mainly from the vendor perspective. So now is mainly still three people. So I don't do very much, to be honest. There is Marta that is doing all this coordination of the affiliation manager. And then at this point, the system is integrated. So it pushed to the pushing of data from our system to the ORCID is done automatically. So what I ask usually my colleague Stevie is like, yesterday, can you give me an update of the number? And so it's fully integrated in a way that when we create a new scheme, a new round of a scheme, we have ORCID ticked. So it's pushed so we can decide, that's our, let's say, it's our decision making. We have to decide, do we push to live, do you push this data to work it or not, depending on the scheme. But at this point, once the integration is done, there is very little to be done. And we are going to change system soon, and we were very careful to select a system as well that had ORCID certified, that there was a system certified with ORCID. So we know that we don't want to spend time in a new integration because, as I say, take time. So this is a reflection for people that might think to do this, but they have to select a new system, select something that has already ORCID integrated. That's my full advice.
For sure. And I'm going to add a link to the chat right now to share our list of ORCID certified service providers. And what this means is that the vendors and service providers listed here, they have all gone through extensive reviews with our ORCID team, and it ensures that the integrations work as they're meant to do, that you can easily do all that you are wanting to do with an ORCID integration. And so it's great to hear from Annalisa and HRB that when you were tasked with finding a replacement system, you were able to look at the certified service providers that we have and find one that will fit your needs. And you won't have to do much work on the back end to get it running. Um,
Exactly.
so thank you for sharing all of that. Our next question is, have you considered integrating additional PIDs with your system? For example, RAID for research projects?
Yes, we're thinking about that, but we haven't done yet because what we want to do is still under the ORCID consortium. I think we are going to look at expanding to other persist identifier. I think there is a funding agency in Ireland is probably more ahead of us, and they're trying to integrate with yes, it's the project with a project ID, but we haven't done, but definitely is in our future vision to integrate with other system. Yeah.
Awesome. And then in your response to the last question, you mentioned a lot about HRB pushing data to ORCID records. So I'm wondering if you could just talk a little bit more about why HRB feels it's important to push data to ORCID records instead of simply just reading the data. Why do you all want to add more data to ORCID records?
Yeah, I think that was probably the main reason we want to ORCID. I know it's ORCID, of course, there are two way. So we can the research can import data and that can facilitate the writing of grant application. But the main, I think from my point of view, the main reason is like we are funding these people, and instead of these people then going, a researcher going to their ORCID and adding HRB as the funder and the grant record and so on, we transfer the data that are correct. And also for people that see that ORCID profile, let's say a reviewer go and look at that. So those are verified. Because sometimes with all the fake that there is in the world, you never know if people have fake ideas when a fake ORCID. Instead, if you have an organization that actually is writing data that are authoritative, they are verifiable, it's as you say, it's a validation of that record and the fact that this person was actually awarded, in this case, was awarded a grant from the HRB.
For sure, for sure. What we refer to that validation is as a trust marker. So HRB is
That's right.
great at adding trust markers to ORCID records, which really helps everyone in the research landscape um, see that this is real, accurate, verified information. And then I think at the beginning of the Q&A, you were talking about how, the process to decide to join an ORCID consortium and get involved with ORCID took about 2 years. Can you talk a little bit about um, how you got the decision makers and the powers that be to see the value in ORCID and approve going forward with it?
Yeah, I think I was actually not involved at the beginning, and then I was given this project in 2021. But in preparation of this presentation, I'm going through the paper that was presented to the board, to the executive team in 2019, basically allowing us to take part of this discussion and the consortium. So I think because the consortium was so, first of all, I think there was a commitment from the top, which is usually quicker. So if there is a commitment from the top, um, there is quicker to make decision rather than you try to convince from the bottom. So that definitely there was a commitment and a vision to say this is the right things to do in terms of adoption of ORCID. And then at the same time, so there was two things in parallel at the same time. Then there was this national consortium, which we thought was probably the best way forward instead of being in a silo in a system, especially like I say, Ireland is quite small. And that's the reason as well we're probably delaying. Well, one of the reasons we are delaying the adoption of our persistent identifier because we want to take a national approach in that too. So you have a body that is coordinating the different the different organization, because some have, are funders, some are performing organizations. Somebody, for example, is health service executive, which is, provide health and social care in Ireland. So they are interested as well. So you have different sources and different type of organizations. So I think a coordination body helps to support everybody. And, if you start to integrate, so if you integrate one, it's challenging, but if you start to integrate few more is more challenging. So I think being together with support from others and, centralized support from ORCID or support from other organization is the best way.
Awesome. It's awesome to hear. Our next question is more of a comment than a question, but Susie is mentioning, firstly, thank you. What a wonderful, fantastic presentation. But wanted to note that with 13 HEIs in Ireland now, as Pure users, we have a two-way integration between Pure and ORCID. So once staff keep their Pure profiles up to date with their ROs through syncing with the Scopus / Web of Science PubMed, then this data is pushed to ORCID, guaranteeing one point of entry for ROs via Pure, and their ORCID profile is updated with ROs automatically. Any thoughts?
Yeah, no, that's great. This is, I think, is from the performing organization, the research performing organization. So that's great.
Awesome. Good to hear. Thank you for sharing that. We do have a few more minutes for questions if anybody wants to submit a last question that's on their mind. Um, if we could go back to day one of your orchid journey, specifically your orchid journey when you started in 2021 and you got this project, what is one honest reflection or lesson learned that you would give your past self to save time and effort?
Yeah, I think yeah, I would be more I think it was difficult to know how long it would take. And we knew the technique it would be challenging, but I think I had in the team two people that, I was a bit out of my depth in terms of the technicality. But, if you have people in your team that understand the technical part, it's fine. And you don't need a big team. I think it was very much the challenges for us was more, and the frustration was very much dealing with the vendor who initially said, say, oh, yes, it's in our roadmap, ORCID, but it was never priority number one until it became for them priority to be developed, be delivered. So the integration, I think, was challenging from that point of view. And so that's the reason my advice is if you can find a system that is already integrated or certified, because the time of integration cannot be underestimated. Depends on the effort. Sometimes, it's not necessary that, our vendor was not necessarily interested, but there were always other priorities. So Orchid might come at the bottom of the priority. So it's very much depending on their interest. So I've been told by other organizations when we were selecting our next grant management system, we don't have ORCID, but we will have in 6 months. And I was like, no, I'm not entirely sure about that. They can't guarantee that. So it is difficult. So in that case, maybe the reflection is to have a clear implementation plan with clear milestones and that a delivery, yeah, deliveries. Yeah. So, but even that is not a guarantee. So there is always a risk, but at least probably to go with a strong implementation plan.
Excellent, wonderful advice. I'm not seeing any other questions, so I want to take the time to firstly thank you, Annalisa, for your wonderful presentation today. It was very insightful and given us all a lot to think about. And I want to thank all of our attendees today for joining us, and I hope to see you all at a future event. Thank
Thanks very
you.
much.